All right, it's 10:32. We're going to get started today. I want to thank everyone for joining us. I'm Alyssa Chenault, UCAN Ohio's Communications Manager, and I'll be moderating and offering technical support for today's webinar. This webinar is intended for ONCE Coalition members or anyone who's interested to provide assistance to Ohioans enrolling in Medicaid. Thanks for your interest and participation today. We're happy to have with us some amazingly knowledgeable experts on Medicaid enrollment. And the purpose of today's webinar is to share information with you that will help you enroll Ohioans in the Medicaid program. So just as a disclaimer, any of the information provided in this webinar today presents current knowledge of implementation and is not considered legal advice. Also, the implementation of the ACA and Marketplace are ongoing and therefore are subject to change or for further clarification. If you have any questions, always reference healthcare.gov for the most recent news about what's going on with the Marketplace. So just to go over a few technical details before we get started, here's a screenshot of what your GoToWebinar toolbar looks like. First, you'll see a little red arrow. This expands and minimizes the toolbar. The toolbar will minimize itself if there's no activity in the toolbar. And if you don't see the toolbar, you will see the little red arrow at the top right-hand corner of your screen. Click that, and it will expand the toolbar so you can control your audio settings and ask a question. Under those buttons, you'll see the audio settings. You have the option to select telephone or mic and speakers. To listen to the webinar over your computer speakers or headphones, select mic and speaker. If you don't have speakers or headphones on your computer, you can select telephone. This option will require you to dial the telephone number, enter our access code, and enter your audio PIN. The access code was provided in the confirmation email, and the audio PIN is located under the phone number on the GoToWebinar toolbar after you select telephone. You don't have to enter an audio PIN due to the size of this webinar. We won't be taking any live questions over the phone. But if you are having any trouble with sound, maybe through your computer, use a telephone for your best connection. And the last and most important box on this toolbar is the questions box. Please enter any questions or comments you have during the webinar in that questions box. And if you're having any technical issues, close the webinar, start it over again. If it's still not working, we are recording this webinar, and barring any technical malfunctions, we will post it onto our website at ucanohio.org. So submit questions as they come to you, and I'll keep track of them and make sure we'll have plenty of time to get to them at the end. So just a few more general housekeeping. I mentioned the questions box. Please submit your questions at any point that they come to you throughout the webinar. We do have a copy of the PowerPoint currently uploaded to ucanohio.org, and we will be sending it out in a follow-up email following this webinar. We are recording this, and just to foster an engaging and secure environment here on the webinar, this is a closed call to the media, and any comments made should be considered off the record. So today I'd like to introduce our presenters. We have Kathleen Geminer from UCAN Ohio, Henry Moeller from UCAN Ohio, Mary Wachtel from Ohio Policy Institute of Ohio, or Health Policy Institute of Ohio. We have Zach Reed from Ohio Association of Food Banks, Deanna White from Legal Aid Society of Southwest Ohio, and a little later during our question and answer section, we'll have Tricia Brooks from the Georgetown University Center for Children and Families. Thank you all for joining us today. And I'm going to pass it over to Mary, and she's going to give us a little introduction about what is ONCE and the work that they're doing. Mary?
Thank you, Alyssa, and good morning, everyone. ONCE stands for the Ohio Network for Health Coverage and Enrollment, and we are the overall sponsor of this webinar today, but obviously are doing that in partnership with many good folks who we're grateful for. The purpose of ONCE is to ensure that outreach, education, and enrollment efforts in Ohio are coordinated so that uninsured Ohioans can understand and enroll in healthcare coverage. We do this by providing regular updates and information, such as this webinar, that supports the work of organizations like yourselves around the state who are conducting the outreach, education, and enrollment. We currently have over 350 organizations in the network. We meet regularly to share information, hear presentations, and network. In fact, our next meeting is Thursday, February 20th, next week, and if you can join us, we'd love to have you do that. Once is a special project of the Philanthropy Ohio Health Initiative, and my organization, HPIO, helps to manage the network. The next slide shows you how you can get more information. If you aren't already on our email list and would like to participate, please contact my colleague Stephanie Gilligan here at HPIO. You can see her information there on the screen, and we'd be happy to add you to the network and look forward to working with you. Thank you, Alyssa.
Thank you. So to kick things off, we'd like to take a poll of our participants here in this webinar today. The first poll question is, have you been asked to help someone apply for Medicaid? And your answers are, yes, I was able to help them. Yes, but I was unable, or maybe you had trouble helping them. No, but I will be asked in the future, or maybe you just haven't been asked yet. So I'll launch this poll, and you can select your answers. I'll give you a few minutes to respond. Not a few minutes, a few seconds. Looks like it's a pretty even split between yes, you've been able to help, and no, but you will be, oh, they've changed a little bit. Thank you for submitting your results. Okay, I'll close the poll. Looks like they've stopped coming in, and I'll share the results with you. Looks like 43% said yes, and you were able to help them. Great, that's great news. About 13% said yes, but you had trouble, or you were unable to. And 25% said no, but you will be in the future. So it looks like we've got a great crowd here today who will really benefit from the information that we're sharing in this webinar today. And now we're going to kick it over to Kathleen to kick off the webinar. Kathleen?
Thanks, Alyssa, and good morning, everyone. I just want to give you a quick overview of the purpose of our presentation today. This is a simple overview of who is eligible for Medicaid and how new rules differ from old rules. We're going to provide issues on some information on some related issues, such as what income counts, eligibility of immigrants, and the relevance of assets. We will do a live walkthrough of enrollment on the benefits.ohio.gov website. We'll also discuss filing an appeal and what to expect when you file an appeal. And lastly, talk briefly about responsibilities of the people who help with enrollment. So expanded Medicaid became effective in Ohio on January 1st, 2014. And there are an estimated 275,000 Ohio adults who are expected to be eligible for this expansion. The enrollment right now is being done separately from healthcare.gov because there has been a problem with the federal website being able to send the information to the state website when people first start out at the marketplace and the marketplace tells them that they're eligible for Medicaid. There is some effort by the federal government, as we understand it, to notify people that they, if they were told that they're going to be hearing something from the state Medicaid agency, that probably isn't going to happen and they need to reapply. But we all do the best we can to get that word out as well. There's no special certifications needed to assist people to enroll in Medicaid online, but later in the broadcast we will talk about how people, or what people, should do when they are helping someone to enroll, some of the best practices. And just one other factoid about the expanded Medicaid is that for those people who are in the expansion, the federal government is reimbursing Ohio at 100% this year, next year, and the year after. And then by 2020, it'll be phased down to 90% being paid by the federal government and 10% being paid by the state of Ohio. So I'm going to tell you who is the newly eligible person. Well, any Ohio adult with income no higher than 138% of the federal poverty level who has lived in the United States as a legal permanent resident for at least 5 years, with an exception for pregnant women who are immediately eligible, and is not eligible for an Ohio Medicaid category that was in existence as of December 31st, 2013. So who was, what are these categories that were already in existence? Well, children with incomes up to 211% of the poverty level, parents with income up to 90% of the poverty level, pregnant women with income up to 205% of the poverty level, the age blind and disabled with income up to 64% of the federal poverty level. And a special note here that if someone was eligible for Medicaid as an age blind or disabled person, but only if they met a spend down, then that person can come into the expansion group unless they are already eligible for Medicare. So as you probably know, there's that 2-year window when people get Social Security but then still haven't gotten eligible for Medicare. So, so that is a pretty sizable group. Now, what is the difference between eligibility under the traditional categories and expanded Medicaid? Well, right now the only difference is the amount of reimbursement that Ohio receives from the federal government. But later there could be some differences in benefits. And this is simply a chart here. It does bring in the 2014 poverty levels, and we did that because they have been published and we're told they have now been uploaded to the federal marketplace, and states have been asked to implement the 2014 poverty levels as soon as practicable. We don't know for sure exactly when Ohio will implement them, but we're trying to put out the newest information because if people fit within these income levels, they are going to be eligible for this period of time. Now, one of the things that when we think about who's eligible for Medicaid in the new world of Medicaid, where we apply what's called MAGI, or the Modified Adjusted Gross Income, it's basically, there's an alignment between people eligible for the marketplace and people eligible for Medicaid in terms of the groups that they fall in. Okay, so the marketplace, when we say APTC, we mean advanced premium tax credits that people can get in the marketplace. But there are a few differences in the groups in the marketplace and in Medicaid, and I'm going to talk about those right now. Okay, so the first exception is an individual who is a tax dependent. Oops, sorry, I shut down my screen for a second here. Individual who is a tax dependent of someone other than the spouse or a parent. So for an example would be a child living with his 51-year-old grandmother who claims the child on her taxes as a dependent. The child has no income. So the child is a household of one, and only the child's income counts, but only if it is above the tax filing threshold. So you can look at that little chart down there. If you have the Medicaid household for the child is a household of one, and the grandmother is a household of two. And that's one thing I want to just point out right now, and that is that I think in the past we used to think of, you had a group applying for Medicaid and they were all pretty much in each other's group. That's not the case at this point. You can have people in the same house applying for Medicaid, and they have different size groups. Different people are in different groups, so you have to always look at who is the applicant. Now, exception 2 would be a child under 19 living with both parents who are not married. So let's say we have a child living with mother and father who file taxes separately because they are not married, and the father claims the child on his taxes. Both parents count toward the child's household size of 3, and you count both parents' income. But the mother's group is just 1 because the child is not on her taxes as a dependent, but the child is taken on the father's taxes as a dependent. So that group is a group of 2, the child and the dad. And then the exception 3 would be the child under 19 and expects to be claimed by non-custodial parent. So the child lives with the mother who does not live with the father and files taxes separately. and the father claims the child on the taxes. So the child's eligibility for Medicaid is based on mother's income and household size of 2, but the father's, if you look down at the last line here, the father's group is 2, the child and the dad, because he's taking them, the child, as a dependent on his taxes. And when we do our walkthrough, that's the example that we will use, and so you can see a little more clearly how that works. Now, there are some notable changes. Before, a child lived, and okay, so a child lives with the parent and the step-parent. The step-parent's income did not count. But now, if a child lives with parent and step-parent, the step-parent's income does count. Okay, these are all, remember, this is all Medicaid. Medicaid then, before January 1st, 2014. The mom's income is from her job and child support. The child support counts. Medicaid now, the mom's income is from her job and child support, but the child support does not count. And finally, Medicaid then, legal permanent residents, adults and children, are eligible if they have been in the U.S. for 5 years, plus they had to have worked 40 quarters, or if children, their parents had to have worked for 40 quarters. But now, children and pregnant women who are legal permanent residents are eligible without a waiting period, and adults who are legal permanent residents are eligible once they've been in the U.S. for 5 years. The 40-quarter work requirement is gone. For the MAGI categories, including expansion Medicaid, there is no asset test. That means that if someone owns a car and it's above a certain value that we always used, that's not a problem anymore. Medicaid services received by Medicaid recipients age 55 and older are subject to a state recovery. That means that the state of Ohio can go through the courts after a Medicaid recipient is dead and seek repayment from the deceased recipient's assets for money spent by the Medicaid program. However, not until the surviving spouse has left that house, and if there are minor children in the home or a disabled adult child, they still can't go after it. Now, in a recent survey that was done by Consumer Reports, Ohio told them that they do plan to exercise the estate recovery provision. But we want to make sure people know that it's very important to make sure that people don't let this become a barrier to applying for Medicaid, because if you think about it, if a person doesn't have Medicaid and they run up a big hospital bill, the hospitals are not going to wait until the person has died or until their surviving spouse has died or left the home before they go after the assets. They're going to go after them right away. So we want to let people know, if they ask the questions about this, that yes, the state could at a later date seek this, but we don't know how practicable it will be for them to do it, and it's still better than not having insurance or Medicaid at all. Now, because we are helping people to apply on 2 different websites depending on their likely eligibility, whether they're eligible for a private insurance plan or whether they're likely eligible for Medicaid, it's important for people who are assisting others to do a brief screening, to try to get a sense of whether somebody is eligible for Medicaid. So the first question is, who is applying for Medicaid and who is in that person's household? And then based on the household size and whose income counts, is that person's current household income no higher than or not much higher than 138% of the poverty level? And is the adult applicant a citizen or a lawful permanent resident for at least 5 years, with recognizing children and pregnant women not held to that 5-year requirement? So if the answer to questions 3 and 4 is yes, then you want to use Ohio's Medicaid application process. And I'm now going to turn it over to Deanna White from the Legal Aid Society of Greater Cincinnati. Deanna?
Yes, good morning, everyone. So now you have helped someone apply for Medicaid, or someone has applied for Medicaid, and so what happens next? What we know from the Ohio Administrative Code is that the County Department of Job and Family Services has 30 calendar days from the date of application to make a Medicaid eligibility determination. So your client, your patient, or you, if you're the one applying, should receive notice from the county within 30 calendar days of submitting your application of whether or not you're approved or denied. You can do the next slide. There you go. So a common question that we get is, I'm approved, yay. When does the coverage start? Here's the rule. The coverage starts on the first day of the calendar month in which the application that was approved was submitted. That's a mouthful. Let's break that down. You applied for someone yesterday, and you find out that you were approved, or your patient was approved on March 12th. When does coverage start? Coverage starts on the first day of the month that you applied. Coverage starts on February 1st. But what happens if your applicant or patient had a huge hospital bill the month before he or she applied for Medicaid? Can Medicaid go back and cover that bill? The answer is maybe. We call that retroactive coverage. And here's the rules. If the applicant submitted bills for services that Medicaid covers to the Department of Job and Family Services in months that the applicant was eligible for Medicaid and the applicant proves it with income information, then coverage can be backdated to the first day of the third month before the application. So let me break this down, because I don't know if that made sense to everybody. It's a lot to digest. The next slide looks at realistic examples. So let's look at retroactive coverage for a newly eligible adult. This is someone who wasn't eligible before January 1st, but is eligible now because of the expansion. Same person, applied on February 12th, 2014. Approved, because it's 30 days, that you get a determination on March 12th, 2014. We already said that coverage is going to go back to February 1st, just with that February 12th application. So we're not worried about bills between February 1st and February 12th, because that gets taken in with the approval. So if you've submitted application income information for medical bills for the 3 months before the application date, the application's in February, the 3 previous months are November, December, and January. Unfortunately for this applicant, they can only be eligible back to January 1st. Even if they were income eligible for November and December, remember there was no category of eligibility for that person before January 1st. So he or she has proven that they're income eligible back to January 1st. They've got medical bills for January 1st. Medicaid can go back to January 1st. But let's look into the future for retroactive eligibility. You help someone apply on July 15th. They get approved on August 14th. Remember, coverage goes back to the first day of the month in which you submitted the application, so July 1st automatically is the date of coverage beginning. Let's look at the 3 months prior to the month of your application, April, May, June. If you prove you were income eligible in those months and you had bills in those months, you can be eligible back to April 1st. Okay. You get approved, maybe you're eligible for retroactive coverage. You're going to get a letter that tells you to call the 1-800 Medicaid hotline number, which I should have put on the screen, but I didn't. I'll rattle it off, 1-800-324-8680, 1-800-324-8680. You can also do a Google search of Ohio Medicaid hotline and get that. You don't have to wait to get a letter to choose a managed care plan. You can call the number after you get your approval notice and select a managed care plan. Here are the 5 managed care plans in the state of Ohio. Doesn't matter what county you live in, these are the 5 managed care plans. If you want more information, you can go to that link to read more about each of the plans. There's also a link to the website for each of the plans and their customer service number. All right, so we talked about the good news. Those are the approvals. But here's the other side of the coin. What happens if you get denied? Anyone who applies for Medicaid in Ohio should receive a letter informing them of their approval or denial of coverage. Page 1 of the notice looks like this. This is an example of a denial. The red arrows point to the sections of the letter that detail the reason for the denial. The bottom box is the most descriptive. So-and-so got denied because the county determined that they were over income for Medicaid. What if you disagree? What if you think they added it up wrong? What if you want to push back on that? Page 5 of the same approval notice gives you information on how to make an appeal, how to request a hearing. It gives you information on the timeline you have, how to see if you have legal assistance in your county with these hearings. But in the next slide, I'm going to show you the most important parts of the notice. Look at the yellow highlights. You don't have forever to request a hearing on a decision with which you disagree. As I've highlighted in yellow, you have 90 calendar days from the date the decision was mailed to you. The red arrow shows the mailing date, which is on page 1 of the notice packet. Add 90 days to that date. That's how long you have to request an appeal. The pink section outlines the common reasons why somebody would want to request a hearing. The first one's kind of tricky. You can request a hearing if you applied more than 30 days ago and you haven't received a decision on your application, but you won't have received one of these notices. That's the whole point. You haven't received a decision. But you can request a state hearing without having received one of these notices by calling the Bureau of State Hearings. There are also, the next green box is going to tell you the other ways you can contact the Bureau of State Hearing if you want to request a hearing. All your client or your patient does is they call the Bureau for State Hearings and say, I applied for Medicaid more than 30 days ago and I haven't heard anything about it. The second pink box says you can request a hearing if your application was approved but somebody in the family was left out of the decision or denied. The third is you can request a hearing if your application was just straight up denied. You can request a hearing if your Medicaid was terminated. You can request a hearing if you were denied a service that you think should be covered by Medicaid or one of the managed care plans. The green section, like I said, outlines the ways you can request a hearing. The orange section offers the phone number where clients or patients or authorized reps can call to see if there's free legal help in their county on their case. I do want to stress, though, that you don't need a legal advocate to appeal your case. The client or your patient can request a hearing and attend the hearing on his or her own. I always tell people these hearings are not done in a courtroom. It says hearing. People get spooked by that. Usually they're done in a room, a conference room at the Department of Job and Family Services, and some are done by telephone. There's no judge. There's a hearing officer, but it's just a person in plain clothes. And then one last plug on the last slide. If you're on this line and you are from one of the 7 counties that we serve, you can call us directly to find out if we can assist with a public benefits denial. Thanks.
Thanks, and now we're going to turn it over to Zach, and he's going to give us some information on whether to choose benefitsohio.gov to register for Medicaid or healthcare.gov, and give you some resources where you can find some more information. Zach?
Great. Thank you very much, Alyssa. I am just going to go over some basic information about the 2 websites that people can use to apply for new health coverage options under the Affordable Care Act. Then Henry's going to take you through a demonstration of the website people are using to apply for Medicaid in Ohio. But first, it's important to understand when to use each website. And as you've probably heard on the news or just through the grapevine, healthcare.gov, or the federally facilitated marketplace website, and benefits.ohio.gov are not currently able to communicate. And the most important communication between those systems would be the transmission of applications for people who are determined ineligible for one program and therefore should have had their applications submitted to the other agency for processing. Because of that issue, it's important that people who believe they are Medicaid eligible use benefits.ohio.gov to apply. If for one reason or another they are unable or unwilling to use benefits.ohio.gov to file their Medicaid application, they can call the Medicaid hotline, and we do have that number here on this slide, and I believe Alyssa sent it out to all the participants, but it's a very important number, the 1-800-324-8680. Then we also have the number there for people with a hearing impairment. As Deanna said, those numbers are easily accessible through a simple Google search as well. Finally, people can go in person to their county Department of Job and Family Services office. And if a person is going to go to a Department of Job and Family Services office, they can fill out a paper application, which can be found from the Medicaid.ohio.gov website. Melissa, if you just want to go to the next one. Great. So in terms of who can help a person apply for Medicaid through benefits.ohio.gov, the Ohio Department of Medicaid has not come out with clear guidance on exactly what certifications are required or what sort of training is required, but they have provided a tutorial straight from benefits.ohio.gov, which I would call critical to watch before you try to help somebody through the process. This tutorial will give you some basic information about how the website operates. It will also show you some screenshots that will verify that your client's application has been successfully submitted to the County Department of Job and Family Services, and it'll just overall give you a sense that you understand the process through which you're going to be taking a client or customer. Great. So Alyssa, if you can give me control of the presentation for just a moment so I can share my screen. I will show you some resources that are available on benefits.ohio.gov as well as the Medicaid.ohio.gov website. So first, we will go to the self-serve portal for Ohio's Medicaid eligibility determination system. And from here, under information links, you can click how to use this site. And then it says to learn more about how to use the site, you'll just click on the link below. It doesn't appear as a hyperlink or anything, but you can click that. And then down here it says here, click here to view this tutorial. If you go ahead and click the word here, it'll open up that tutorial and plays just like in a YouTube video or other video that you might play online. The other resources that I wanted to point you to could be really helpful to you and your client as you are working through the application if they have questions. One that was brought up is the estate recovery. This is a concern that a lot of people have. Well, if I'm on Medicaid, I won't be able to pass anything along to my family. As Kathleen said, it's really important that we're talking to people about the reasons for having health insurance and helping to get over some of those fears. And to support your work in doing that, you can use some of the resources available on Medicaid.ohio.gov. I'm just going to point you under Resources, Publications, Fact Sheets to a fact sheet about estate recovery here in the state of Ohio. Again, this is just a resource created by the department to quickly answer people's most pertinent questions related to estate recovery. Again, this is just one example of the resources available on that website. We'd strongly encourage you to review the tutorial and look at these other resources before you start helping clients apply. That's all I have to talk about. Thank you.
All right, thanks, Zach. All right, and now we're going to throw it over to Henry, and he's going to go over an example and a live walkthrough. But first, he's going to kind of show you the example of the type of family we're going to be doing the online tutorial with.
Thanks, Alyssa, and I will get started in a moment to show you how to use the website And it's just going to be a brief run-through of a Medicaid application on benefits.ohio.gov, and I hope it clears up some of the confusion over the application process and allows you to better help healthcare consumers fill out the application as completely and efficiently as possible. For today's purposes, our family is going to be a dad and mom who are divorced and living separately. They have 2 children, ages 8 and 10, who live with their mother. They file taxes separately, and the father claims both children as dependents. The father earns $26,000 per year, the mother earns $20,000 per year, and the father pays a child support payment of $750 a month for both children. And for this application, it's going to be the father applying for Medicaid. And we already have an account set up for this scenario, but I just want to real quickly take you through the brief eligibility check for the Medicaid website. Okay, sorry about that. So the first step in check your eligibility is just to say you're looking for coverage for yourself. And for this, we're just going to go through quickly a household of 1. And now just a brief point on this, even if one of your consumers has an income of $0, you want to put in a value from 1 to 5, just because the system is set up that if they put 0, it's not going to recognize it, and it might mess up the eligibility. And then these are just some brief questions here. We're going to put no for all of these just to speed it up a little bit, but they're just questions about long-term care waivers, disabilities, things like that. Now we learned that we might be eligible for Medicaid, and it's going to have us start creating an account. So right here, we're going to apply for assistance. And we already have an account, but just real quickly, I want to show you what to do to get a username. Just a few things I want to point out about this page. There are parameters on the username and password you can use. Usernames cannot use special characters, and the password must have at least 8 characters and must contain at least 3 of the following: an uppercase, lowercase, number, and special character. And you'll want to make sure that each consumer writes this information down for their future records. And also, each consumer needs a separate account, so you can't have one account and have multiple applications go through it. Okay, so now that I've shown you that, I'm going to log into our fictional account here. Just one second.
Henry?
Yes, ma'am.
You've got the wrong ID. It's J. Rodriguez.
Thank you, Kathleen.
Okay. And a small j.
Okay, now it's showing a general error has occurred. Kathleen, I'm not sure if you want to jump on.
I can't. Let's go back. It's February with a capital F.
Right.
You got your cap lock on, so you've got to get your cap lock off. You see what I mean? It keeps telling you the cap lock is on.
There we go.
Okay.
Okay, so now we're in. So we're going to continue with our saved application. We're going to start at the beginning. And this screen, by clicking it, just says you allow to have them use your information retrieved from different data sources. So it keeps kicking us back. Okay. So one note I want to make about this page is that consumers will want to click Save and Continue when going between pages at the bottom instead of just clicking between the tabs, because if you don't do Save and Continue, you might lose your information. And also, you need to follow the format of the application exactly. So if you look at the phone number, there's a parentheses and a dash there. You will need to put that in exactly how you see it, or else it's not going to accept the value. And when things like this pop up, it's just to give you a more specific address, nothing to worry about. All right, so this is the page just to get some information to verify identity, things like Social Security number, marital status. And on the question of do you have a physical, mental, or emotional health condition that causes limitations in activities, this is really for consumers who have, either a diagnosed disability or condition. You might get someone who may say, well, I'm having trouble doing my laundry sometimes, but really it's people with, a diagnosed or verified condition. And then also to the point that was talked about previously about if you owe medical bills for the last 3 months, Medicaid can go back and retroactively pay for those bills if the consumer was eligible at that time. And you'll have some demographic and language information here. You'll just want to make sure that if English is not your consumer's language of comfort, that they'll want to pick whichever language is most comfortable for them. And this is just questions about what kind of income the person has. It will get more specific later on. And if they have, some savings, and questions about monthly rent and utility payments. All right, so anytime you see a blue screen like this, this is a review page. So this is going to pop up. Sometimes it's confusing, but really all this is just to make sure that all the information is correct. And it's a lot quicker and more efficient to review each of these after the sections rather than waiting till the end to go through the application. Okay, so now it's just showing us a review page of the household information because we've already put it in, but I want to go to the edit page just to see when you are adding someone to the household, this is what the page will look like. And it's going to ask you the same questions it asks for the person who is the head applicant. And also the same demographic information. And as you can see, there are 2 children in the household, but it would be the same. You'll put the same things in. It will be the same application page for the other child as well. And to add another person, you just come down here, click Add a Person, and the same screen will pop up. So go ahead and save and continue. And now Jorge, who's the head of the household, he is working. So we want to put yes. And then the next questions, again, this is a review page since we put the information in, so I just want to show you. You'll want to put down the name of the school and what status the student is in that school. Okay, and now this is just Jorge's information. So we'll go to Edit just so you can see what to put in. He works at a car shop. He's a supervisor, and you'll want to put in his monthly gross income before taxes. A lot of people are confused about that. Again, another review page. And this is the education review page. Okay, and now here are some questions about other income that Jorge might be getting and deductions. Now note, we did say yes, that Jorge does have a deduction, and after we go to the next page, it will ask us about what that deduction would be. I want to go to the edit page for this. And you can see that there are 2 options for alimony and student loan interest. Jorge does not have any of these, but he does have a $750 a month under other deduction, and that other deduction type is child support. So that's how you'll handle the child support. Okay, and now this page, which seems very long and scary, is just to get tax information. So in this page, we're saying that Jorge Rodriguez is the head of household. He's the primary tax filer and taxpayer. He has 2 dependents who are Enrique and Elena. And so you'll just want to go through and make sure that all the relationships match up. And again, just another review page. And this is the relationship page, just to clarify how each person in the household is related. And now just a note about this page is if anyone is offered health coverage from a job, they still might be eligible for Medicaid. It depends on income and family size. It's just to determine who pays first on the insurance claims. We won't worry about it too much here, but the main point is that even if someone has coverage through a job, they can still be eligible for Medicaid if they fulfill the other requirements. Okay, and this is the health check and pregnancy-related services information sheet, which we can go ahead and click on here. It's just a rundown of the different benefits that are covered through Medicaid regarding pregnancy-related services. So certainly, if you're helping a consumer who's pregnant or who's maybe thinking about becoming pregnant, definitely something to read through. Okay, another review page. And this is just a page about if anyone helped complete the application. I just put in UCAN Ohio's information just to save time here. And also it's important not to skip over the question about if they're registered to vote and would they elect to apply to register to vote. Certainly just let the consumer make that choice for themselves, but you'll want to ask the question. Just another address, correct? And this is the page that shows you where your application will be submitted. You'll want to make sure the consumer knows which office it's being submitted to, because there are multiple offices, and that will just help the consumer be able to track their application a little bit better and know who to get in contact with if they have any questions. And this page is just to let you know that you can upload documents for things like identification, utility expenses, income, things such as that. And this next page is just your verification that all the information is true. You'll put your electronic signature in. Certainly we recommend that you use the website, and if you want to do practice applications, that's totally fine. Just at this page, you will not want to enter the electronic signature and click that box to submit the application, because it will be sent to Job and Family Services as a live application. There's no way to differentiate between a live application versus practice application. So just for their sake, to take a little work off their plate, please do not submit the full application. And that's the end of the application here. Alyssa, if you want to take it back over.
Okay, thanks, Henry. Now Kathleen's going to talk about what are some of the additional responsibilities of people who are offering assistance to enroll in Medicaid. Kathleen?
Yes, as Zach mentioned earlier, there have not been any rules established for what somebody helping someone else apply for Medicaid has to do. So we just want to point out a few things that we think are very important to remember. First of all, the normal rules of anyone doing this assistance for their profession apply. So if you're a social worker and you're helping someone apply for Medicaid, then you should follow the same rules that you normally would with respect to confidentiality or how you protect information, etc. We recommend that you make sure that the browser history has been erased before and after you offer assistance. So you just, if you're, whatever browser you're using, there's a place to click history and then erase history. We ask that you do that after you've helped someone to make sure that there's no chance any of their personal information could be accessed by anyone else coming to use that computer. But then just as a double check before you do it with someone, in case the last person forgot, we do it before as well. Don't retain consumers' personal information, unless there's, again, if you are, let's say, a social worker with an agency, well, you have certain agency rules of what you, would normally collect and how you would store it, so you would follow those. But in general, we recommend against retaining any of their personal information. Ask the consumer to enter their own data into the computer if they're able. That's especially a good protection so that you haven't even seen their Social Security number because they entered it themselves. If they can do all the work on the computer themselves, that's the best, but sometimes people aren't familiar with that. You want to secure a signed authorization from a consumer if you're going to discuss his situation with anyone else, such as another caseworker or a health center or the doctor, because your agency may have multiple obligations, that maybe what you do is help link people to health care. So if you're going to help them with Medicaid and then make a phone call on their behalf, then you want to make sure you have a signed authorization as to who you can communicate their information to. And then don't release their personal information to anyone. Sorry. Go ahead, Alyssa.
All right, now we're going to do a poll question that asks what aspects of helping someone with Medicaid enrollment that you'd like to learn more about. We know we covered a lot here, and there's a lot more we could do, so this will help us determine what webinars we should offer in the future. So let me launch this poll. And your options are, maybe you'd like information on eligibility criteria, like specifics about income and household size. Maybe you'd like to run through a couple more scenarios on benefits.ohio.gov. Maybe you'd like more information on the responsibilities of people who are helping with enrollment, or some more information on the training on the rules and regulations, including the hearing and appeal process. Or maybe you'd like to learn something else about Medicaid enrollment. Select Other, and then you can send me your idea in the chat box, in the questions box, and I will pass it on to our presenters to talk about future webinars. All right, so I'll close the poll, and I'll share the results. And it looks like 64% of you said that you'd like more information about eligibility criteria, and then next up, training on the rules and regulations, followed by some more in-depth training on benefits.ohio.gov, followed by responsibilities of people who are helping with enrollment. And it looks like a few of you had other ideas, so just shoot those to me in the questions box, and I'll pass those on to our presenters. And one more slide before we open it up to more questions. Oops. There you go. Kathleen?
Okay. Just for some closing tips, you want to determine eligibility, mostly following the tax filing group, with certain exceptions, and we described those above. You don't need to file a tax return to be eligible for Medicaid. There is no asset test for these MAGI groups, the groups we've been talking about, but it is subject to a state recovery. You want to make sure the consumer has the contact information for the local job and family services that will be handling his or her application after completing an online application for follow-up purposes. And I did want to just mention one thing about the walkthrough that we just did. Child support is actually not deductible on a tax return, but the reason that we put it into the example is just that when someone does, pay out any kind of a regular a payment such as that, there is a way through Other to put it in just in case it's of interest or of help. I'm not sure that it would make any difference in this particular situation as far as his Medicaid eligibility goes. He is getting the dependency. He's taking the children as a dependent, which then gives him a group of 3, which is probably about all the help he'll get in becoming Medicaid eligible. And even though that particular walkthrough didn't say to the person, you are Medicaid eligible or you're not Medicaid eligible, with that income, he should, and the three in his group, he should be Medicaid eligible. Okay. So to get help, if you're in Columbus, you want to call our office, 614-456-0060, extension 228. If you're in the southwest part of the state, you can call Legal Aid of Southwest Ohio, 513-241-9400. If you're in Cuyahoga County, you can call the 211 system, and they will link the person with some help. In Dayton, there is the Helping Hands Community Outreach Center, and that phone number is there as well. In any other part of the state, the best solution for you is to call 800-648-1176, which is the Ohio Association of Food Banks, or you can call the Ohio Association of Community Health Centers, and they can help you find a health center in the area. All of the health centers do have a grant to provide assistance to enroll people both in the marketplace and in Medicaid.
All right, so now we're going to take some questions. Some people have been submitting them throughout the webinar. Thanks for that. If you haven't asked a question yet but would like to, please submit it in the questions box. We've got about 30 minutes to answer these questions. Let me take a look at what people have been saying. Okay, we've got a question from Timothy, and he asks, if someone has family planning Medicaid, can they apply for the expansion?
This is Deanna. Yep, the answer is yes. If they have if they got planning Medicaid before January 1st, they probably got it because that was the only thing they were eligible for, because the income level's higher than that for that category. So if they haven't applied since January 1st, they should certainly try.
Okay, thanks. Okay, we've got excuse me, a question from Deborah, and she asks, what if the applicant does not receive a determination within the 30-day period?
Well, one of the 4 or 5 reasons that you can request a hearing is because there is a delay of your eligibility determination. So get your pen and paper, and I'll give you the phone number they can call. They can call the Bureau of State Hearings at 1-866-635-3748. I'll say it again, 866-635-3748. They tell the operator at the Bureau of State Hearings that it's been more than 30 days since they applied and they haven't received a decision.
Thanks. Another question is, are all of the Medicaid managed care plans available in all Ohio counties?
I feel like I'm hogging this Q&A. Yes, all 5 in all 88 counties.
Okay, we got a question about the estate recovery. It says from Kendra, and she asks, what if someone was on Medicaid prior to the first of the year? Will the estate recovery apply to them as well?
This is Kathleen. Remember that it only applies to people who are 55 or older. So the reason this has suddenly become an issue is that so many people now are eligible who weren't eligible before, between the ages of, say, 55 and 65. So we've always had, this provision's been in place since 1997. I think the federal government enacted it, but it mostly applied to people who were in long-term care, and so it, or there were, of course, people between 55 and 65. It just was a much smaller group of people. So we're not talking about people on Medicaid under the age of 55.
Okay, we got a question from Ariel, and she asks, to get retroactive reimbursement for medical expenses, do you have to prove eligibility in the months where the expenses were incurred?
Yes.
Yes.
You have to You have to submit a bill to Job and Family Services that has a date of service in a month that's in the retroactive period, and you have to submit pay stubs or other income verification to show that you were eligible in the month where you had the bill, and there has to have been a category of eligibility that you were eligible for in the month where you submitted the bill, where you had income that was made you eligible.
Okay, another question from Timothy. He asks, if a couple is in the same household but not married and they're adults, do they complete separate applications or can they complete one under the same?
Alyssa, I don't know if you're able to go back in the slides, because I think if you get back to those slides, I don't know exactly which number, but where we had the 3 exceptions, are you able to do that?
Yeah, I can go back to it.
Okay, let me try to find the number here. It would be exception 2, slide 17. Okay. Now here, of course, we said the exception, we talked about a child under 19, but we have all of the groups here. So the child, now this, we're assuming here this is mom and dad, okay? It's the child's mom and dad. The child has a group of 3, child, mom, and dad. The mother is a group of 1 because it's the dad who's taking the child as the dependent. And so you've got, you know, they can all apply, but they've got different groups. And I think, and Deanna, help me out here, and maybe Henry can help me out, or maybe Trish is with us by now, but I believe they would have to set up 3 separate account numbers. Is that right, Deanna or Henry?
I'm not sure. I know that the Medicaid application says to file an application for everyone who's in your tax household. So if they're not filing a joint return, then to me that means they are not in the same tax hold and would file separate applications, but I don't feel 100% confident on that.
Yeah, it may be that the child and the dad can go in on one
right.
application, and then mom would be another. So you wouldn't have 3 separate applications, even though you have 3 separate groups.
No.
You would just end up having 2 separate applications.
Right.
That'd be my thought as well.
Yeah, if dad's claiming kid, then dad and kid are in the same tax household and go on the same application.
Yes, and I think you would have to then do 2, that means doing 2 separate accounts as well on the website.
Definitely.
Correct.
Yeah. Okay.
Correct.
Okay, we've got a question from Timothy and Kathy. They're both asking, what forms should you upload before you submit the application? Like, what are the most important ones to submit before you actually submit the application online?
This is Henry here. Typically, what I've heard is when Job and Family Services request documents, a lot of times it's immigration documentation, things like wages, paychecks. That's what they're looking for. So it's kind of just a proactive thing to get that in there before. But even if you don't, Job and Family Services will send you, you know, information about what you need to send them, and you can either scan it in then or mail it in. So you don't have to do it before you submit the application. It just speeds things up a little bit.
Deanna, do you? I think I'm going to share something you raised yesterday via email with us, but it appears in some cases the Department of Job and Family Services has denied people eligibility when there is a big difference between their current income that they report when they apply and what was on their 2012 tax return. And so they shouldn't deny. They should simply send the person a checklist and let them know that they need current information. However, it may be that you could avert that possible denial by, you know, uploading that pay stub information so that it's clear right away to the worker who's processing the application that the person, you know, does have the documentation to show that they are currently eligible.
Okay, and I just want to remind everyone that this PowerPoint is available on the UCAN Ohio website. That's uhcanohio.org to use as a reference in the future. And a couple more questions. Is it the applicant's responsibility to submit income info to JFS for retroactive coverage? Julie asked this question.
Yes. So that is not as easy. I wish that was a yes or no question. In general, yes. There's a question on the application, the online application and the paper application, that asks whether or not you've had any medical expenses for the last 3 months, and that's driving at whether or not you may be requesting retroactive eligibility. If you don't upload bills and income information for the months that you need retroactive coverage, then you should, when the system is working properly, receive a checklist from the Department of Job and Family Services that says, send us income information and bills for the last 3 months. The reason I'm stuttering is because if your client or patient or applicant cannot produce that information for whatever reason, they can't get a ride to UDF or Kroger, their manager won't fill it out, your client should ask the Department of Job and Family Services for assistance in obtaining those verifications, and then the responsibility transfers to the county agency to assist the applicant in obtaining those verifications.
Okay, thanks. A question from June. She asks, if a client is offered insurance through their job, do they have to take that insurance from their employer before they apply for Medicaid?
No.
Okay, easy
I
enough.
can expand on that if you want.
Yeah, why don't you
expand
on that, and then I'm going to jump in and say something about how that applies in the marketplace.
So yeah, the availability or the quality of the coverage that you're offered from your employer has no impact on whether or not you're eligible for Medicaid, but does have an impact on whether or not you're eligible for Obamacare. Kathleen.
Okay, and so yes, if let's say you applied in the marketplace because your the amount you're paying for your premium just is greater than what your budget really allows for. Most likely you will not be able to get a tax subsidy in the marketplace. There's 2 exceptions to that, and one of them is if the plan being offered by the employer doesn't meet certain minimum requirements. The other is if, and listen carefully because this is very counterintuitive, but the other is if the portion of your, let's say your share of the premium is greater than 9.5% of your household income, okay? So that doesn't, unless it's a person who is an individual so that, you know, they're a household of 1, or if no one else in the household is working, so theirs is the only income, then that might happen. But unless one of those 2 exceptions is met, then you can't get the subsidy in the marketplace. You could still go to the marketplace and buy insurance instead of your employer's insurance, but you wouldn't get a subsidy to do it.
And Kathleen, this is Tricia Brooks. I just wanted to let you guys know I joined. If I could just also add something there to make it, because it is hard to explain. When you say if your insurance at work costs more than 9.5% of your household income for you, the individual worker, regardless of how much it costs for you to enroll your entire family. It is something that you may have heard referred to as the family glitch, and it is one of those unfortunate pieces of the law that needs to be tweaked.
Okay, thank you. And thanks for joining us, Tricia. Welcome. Okay, question from Tracy. She asks, if we're completing an online application on behalf of someone over the phone who maybe they've previously seen how do they go about doing the electronic signature at the end?
Sounds like maybe that's a Henry question. Are you still with us, Henry?
Or Zach, if you're still with us too.
I was just thinking about that. I'm not exactly sure how to go about doing that. The only thing I have done is if there's been problems with the system, this has happened multiple times where we go to do the electronic signature and it's not working. I get a release form from each consumer saying that they authorized me to submit their application with their electronic signature, and you always want to put an expiration date on that. I usually do 2 weeks afterwards just to make sure that all your bases are covered. So over the phone, I'm not exactly sure how to handle that. The only thing I would say is if you could get a written authorization from that person saying that you are allowed to submit the application and use their electronic signature, and I guess, Kathleen, you might want to comment on this, but I guess that would be okay?
That's what I've done. Same thing that Zach's done. I have had the consumer sign an authorization that I could later, when it's working again, submit for them. And then I have that expire, at a certain fairly soon time in the future, so that it's pretty clear that it's a very limited authorization.
Yeah. This is Zach. The only other input I would add is perhaps trying a different browser in that situation. Seems odd, but sometimes it works.
Yeah, definitely.
Okay, we've got a question from Dolores, and she asks, are any undocumented persons eligible for Medicaid?
Undocumented folks continue to be eligible for a special category of Medicaid that I pronounce IEMA, the Alien Emergency Medical Assistance. It covers the most common thing we see it cover is labor and delivery for undocumented mothers who give birth here in Ohio. It can also cover other emergency-related episodes, and emergency is defined in the law for brief episodes. So yes, they continue to be eligible for IEMA. Undocumented folks are not eligible for regular Medicaid coverage or expansion Medicaid.
And just to double up on that, this is Henry speaking. IEMA, it does cover very limited services. I believe the phrasing, it's acute onset of symptoms, and they'll treat the symptoms, but they won't do any rehabilitation services or anything like that. So just something to keep in mind there.
This isn't, but I just want to piggyback. That's an appealable decision. So if you have someone who you have an emergency room doctor, and P.S., the services don't have to be provided in the emergency room to qualify as emergency services, but if you have a doctor that says this was an acute episode that would have resulted in the loss of life or limb, and the Ohio Department of Job and Family Services denies the Medicaid, that could be a good reason to appeal and ask for a hearing.
Okay. Can you go over again what the situation is with when to apply on benefits.ohio.gov versus healthcare.gov?
This is Kathleen. I'll jump in there. If the person appears to be eligible for Medicaid, then we suggest you go to benefits.ohio.gov. If you go to the marketplace in that situation at healthcare.gov, you enter the various, you create an account and you enter the information about the person's income, and you get a message that says, this person appears to be eligible for Medicaid, so we're not going to let you go ahead and select a marketplace plan with a subsidy. And so then you've kind of wasted the time, because they say that your state will, be in touch with you about Medicaid, but in fact, because of the electronic communication difficulties, the state isn't getting that application and isn't going to be in touch with them, and they're going to have to apply again. So that's the reason we suggest if it's pretty likely they're eligible for Medicaid, just go straight to Medicaid. And if Tricia or Deanna or anyone wants to add anything else to that, or Zach, to how you figure that out, feel free.
Well, I know you've got a chart in the webinar that shows the income levels for the different programs. I think it gets a little more complicated when you have families where their children would be eligible for Medicaid, but they themselves would be eligible for premium tax credits. And then I think, we will eventually resolve this communications problem. So it depends on the urgency with which people need to get enrolled. I mean, obviously we have a deadline coming up for the marketplace, and so we wouldn't want to wait to put that family through benefits.gov for the adults to get sent over to the marketplace. At the same time, the children may have some immediate health care needs, and in that situation, you might want to file an application at both. And so, it does get down to individual circumstances that, we're certainly happy if sisters have questions about those to submit them, up to Kathleen or Deanna or someone, and they can get them to us if need be to offer some advice about those particular situations, because I am concerned as we're getting down to the wire here in open enrollment.
This is Mary. If I could just add to that, Tricia brings up a good point, and that is that to not be, I guess, shy about or concerned about starting a second application. If you're working with a client who has already applied through healthcare.gov and has not heard anything because of that communications glitch, it is perfectly okay, and in fact conversations we've had with state officials echo this, to go ahead and start another application on benefits.ohio.gov, i.e. not to worry about potential duplication.
Okay, a couple more questions we'll take in the last 10 minutes of this webinar. If you haven't submitted any questions and you'd like answers to them, please submit them in the questions box. We'll try to get to as many as possible. Question from Aaron is, if a consumer doesn't enroll in Medicaid by March 31st, will they face the individual mandate penalty?
If the consumer doesn't enroll in Medicaid by the 31st, if they have no insurance by the 31st and they haven't secured an exemption from being insured, then yes, they are subject to a penalty. Now, here's the thing. If they're eligible for Medicaid, a lot of folks eligible for Medicaid will have an income low enough that they don't hit the filing threshold for taxes, and then that's one of the exemptions. So it gets a little tricky there, but they should apply for Medicaid by the 31st to be sure that they won't have a penalty. And remember, the penalty gets assessed by taking it out of your refund. So if you don't file taxes now and you're not going to file taxes next year, then it may never really make a difference. And if Trish or Mary or Deanna or anyone else wants to add to that or tweak it at all, feel free.
No, I think that's right.
Yeah, that is correct, and I just want to let people know if they have questions about their need to file or need assistance filing taxes. There are many free tax preparation resources available throughout the state of Ohio, including the VITA program, the AARP program, and the Ohio Benefit Break program. People can call our 800 number, 1-800-648-1176, to find a site where they can get some of those tax questions answered.
Okay, we got a question from Deborah, and she asks, what recourse is there for folks who are having challenges dealing with their local JFS?
Well, it's hard to say without knowing a little bit more specific about challenges, Deborah. So I don't know if you can type in something, if they disagree with the decision, they can request a hearing. But if you could be a little bit more specific, I'd be happy to address that.
Deborah mentions that the staff won't answer questions or that they deny people almost automatically when they do in fact qualify, or some examples she gave.
Yeah, one of the concerns that Kathleen alluded to before that I'm concerned about that has just recently come to our attention is that people are being summarily denied without a checklist being issued asking them to verify eligibility factors like income. And those should be, you should absolutely request a hearing if you have been denied and you disagree with the decision. Staff won't answer questions is harder. I mean, honestly, right now, some of the actual people that work at the Department of Job and Family Services don't have a lot of the answers because their questions aren't getting answered. They're having a difficult time understanding these new systems that accompany the expanded Medicaid eligibility system. So I don't know that they're necessarily ignoring folks. In some cases, they may just not have the answers themselves. Kathleen, can you think of, can we go back to that resource slide?
I was going to, I was actually going to ask Mary if you wanted to take an opportunity to just talk a little bit about what ONCE is doing to try to resolve some of these issues.
Sure. I think I'm unmuted. Yes.
Yes, you are.
Thank you. Our overall purpose at ONCE is to really help support organizations like yourselves who are providing the assistance directly to consumers. And as part of that work, we're in some conversations with state officials, Office of Health Transformation, Department of Administrative Services, folks like that who have responsibility for Medicaid and benefits.ohio.gov to establish a more efficient feedback mechanism so that questions like these have a place to go and can get some resolution. The top line advice is that when you have problems with cases, to call the consumer hotline, and that's a number we've given out before. And that can help in many cases, but what we're finding is that sometimes there are more systemic issues. This training issue is an example. There are many, many, many JFS workers at the county level, many of whom have been trained already, many of whom have not yet been trained, and it does seem to be leading to some inconsistencies in consumer experiences. So I guess I can't say there's a resolution per se, but I can say that there are some good and productive conversations going on in how to establish a more organized fashion that some of these systemic issues can be identified, communicated to state officials, and then work to be resolved. And once that resolution happens, and we hope quickly, we can collectively get the information back out to the network. So we can keep people updated. There's actually a meeting later on today that some of the folks in this call and myself are going to participate in to try to nail down some of these issues and a process for that.
And this is Zach. If I could just add one more thing to that. I spoke with a few of the county representatives that are working on a lot of the changeover in systems just this morning, and explained to them that we were hearing a lot of complaints about the level of training of individuals that are answering questions in the major metropolitan counties, primarily Hamilton, Franklin, and Cuyahoga, getting some reports from Lucas and Montgomery as well. Those representatives were very clear that if an individual has filed an application on benefits.ohio.gov and they have a confirmation number, then their county office should be able to process their application and answer questions about their case. Their recommendation in those situations where a client was feeling like they just weren't able to get anywhere over the phone, they recommended printing the confirmed application from benefits.ohio.gov and going into the county office. They did express that in most of the non-metropolitan, major metropolitan counties. They're pretty well caught up on the processing of the applications.
And I want to jump in and put my fellow panelists on the spot. We always, I'm guilty of this, sort of overrepresent our metro counties, but I know there's folks on this call from smaller rural counties that don't have connections to the resources that the metro counties have. And if they have questions, who do they turn to? Who do they email?
So are you saying if they have questions about, they need help, basically?
Yes, yes. So
we
have this screen up about where our metro counties can, where these folks can call. Any ideas for people that are sitting out in Greene County or Gallia? There we go.
Yeah, all other areas.
Perfect. Sorry I missed that.
Okay. Well, and just let me just say, I mean, and Zach would say it as well, the Association of Food Banks takes calls from all over the state. It's not like if you're in Columbus, you can't call them, but we're just trying to give you a wide range of resources that are available, and so where we have a special resource in some of those other areas, we wanted to make sure that people knew about that resource.
Yep, I get it. Thanks.
Okay, I'll take one or two more as we wrap up here. Question about when do we start using the 2014 federal poverty levels to determine eligibility?
This is Kathleen. I think in some ways the question is, when does Ohio load the 2014 poverty levels into benefits.ohio.gov? And I don't think we have an answer to that yet. I'm hoping we may know more about that shortly. And certainly I would defer to Mary if you've heard anything more recent, or Zach, or Deanna.
We haven't. It is high on the list to track down that information and get clarification from the state.
But the thing to remember is it's a good benchmark for whether somebody's really eligible or not, because if they fit within 2014 eligibility levels, and it's only a matter of time until benefits.gov is going to catch up with it. So if you know they're eligible, they're right on the line, and you can tell they're eligible, but benefits.gov is saying they're not eligible, you might just want to wait and refile that application in a couple weeks, or when you hear that they've actually started using those poverty levels.
And there looks like about a $300 differential. It looks like all the eligibility levels went up about $300 annually. So don't take that to the bank, but if you want a sneak preview of what it's going to look like, that's about it.
Okay, I'm just looking through the questions, see if there's any last one that we can answer as it's 12 o'clock, but I think we will end it there. We got to a majority of the questions. A few people submitted some really specific questions that I will pass on to our experts to get answered, and I'll forward them your contact information. But if you have any other dying questions that you didn't get a chance to answer, please shoot me an email and make sure that they will get to the appropriate person. I'll put in my email address in the chat. I just want to thank our speakers. Are there any last-minute parting words that you'd like to share with our participants in this webinar today?
This is Kathleen. I would just say that since the webinar we did last week, I've already seen, a big uptick in people asking questions and reaching out, and it's really very encouraging. So I just really want to encourage the people who have been on this webinar to do everything you can to let the people you're in contact with know about the Medicaid expansion and help them get enrolled. And if you get stuck, then give a holler for help from people, like ourselves who have been doing this work for a while. And I think our contact information is being put up on the screen right now.
All right. Well, this concludes our webinar. We'd like to thank everybody who took time out of their day to participate. I will be sending this PowerPoint that includes all of the slides in a follow-up email later today. As always, if you have any questions, please contact any of our speakers today or contact me. We'll be sure to get back with you. Thanks for participating. Please share this information with other colleagues that you work with. And this concludes our webinar. And have a great afternoon.